Hi, this is Dr. Keith Loud. I'm the physician-in-chief here at the Children's Hospital at Dartmouth-Hitchcock. We are open and safe here at CHAD. We are able to take care of pediatric needs as necessary. We're pretty good at keeping kids with respiratory viruses separate from those who aren't, because kids do get respiratory viruses all the time. So if need be, you can feel comfortable that your kids will be taken care of safely here at CHAD, either in the inpatient or the outpatient setting. We've also been able to utilize and ramp up our use of telehealth, which will probably be a great thing long term. So calling your pediatrician, you may end up being asked if you're willing to do a telehealth visit, which spares you any trip in. And a significant number of our visits have actually been able to be done through telehealth, either video or telephone, to reassure you that your child is safe and healthy. I want to reiterate and make sure that we thank and give our kids all high fives. Their lives have been significantly disrupted, just as all of ours have. School is such an important component of their lives, and for them not to be there now for going on 3 weeks is challenging. Kids are people too, and so all of the efforts that we're using to decrease the spread of the coronavirus, the new coronavirus COVID-19, are important. Hand washing is always the key. And so teaching your kids how to hand wash for 20 seconds and or use Purell or an alcohol-based sanitizer is important. Staying home when you're sick is essential. And all of the physical distancing is also important. We've added some new things lately, like masking in public or wearing a mask when you have to be out in public settings. It's important to note that those don't replace the previous measures we've been doing. They're not more important or better, quite frankly. They're an addition to. So don't replace masking with not hand washing, staying at home when sick, and doing the distancing. And the kids are capable of doing that as well. So how can you tell if a kid or an adult has COVID-19 or the novel coronavirus? In both cases, it's going to look probably pretty similar. Fever and cough are the hallmarks. Shortness of breath is noted, although more in adults than kids from the data we've seen so far. Adults are probably more sensitive to the notion of shortness of breath, and adults might notice muscle aches and fatigue. Kids may be a little bit more runny nose. I'm saying a lot of maybes, though, because the actual case rate for kids is very, very, very low, perhaps only 1.5% of all cases worldwide, despite kids being closer to 20% of the population as a whole. So we're speculating. But in the studies done in the U.S., released by the CDC and MMWR, 73% of kids will show symptoms and 93% of adults will show symptoms. So we still can rely on that. So the question is, when should you call your pediatrician, or what should you do if your child sustains an injury? They should call. They should call their primary care physician. They should call their pediatrician if that's the primary care physician, because we can see these kids safely. Most of these children will not have COVID as an infection, and even if they do, we can appropriately protect ourselves with PPE. Everyone's heard about personal protective equipment to see the kids. When care is needed, it will be provided and should be provided. For more advice on keeping your family healthy, keeping all of us healthy, and how to talk with your kids about the coronavirus COVID-19 pandemic, we have resources online at www.chadkids.org. And as I said before, never worry alone. Don't hesitate to call your CHAD pediatricians to ask for more advice.